So let's start with parasitology part 1. In this we have of amoebic organism, flagellates, hemoflagellates, coccidian parasite and hematozoa, right? First we will start with amoebic uh, organisms. In this we have 5 things. First is Entamoeba histolytica, Entamoeba coli, Naegleria floweri, Encapsulamoeba, which these two are free living. Then we have Balantidium coli, right? So in Entamoeba histolytica, what is that? This is one which is flash shape. It is amoebic. It is anchovious appearance, and also it is chocolate pus, right? All these things are there in Entamoeba histolytica, right? And then comes intestinal amoebiasis. It is the one which has stool with mucus and abdominal plane, right? In this it will be what GI dysentery, Giardia lamblia, and drug of choice will be metronidazole, right? In this there will be consecutive. If we have to take the samples, it will be 3 consecutive days sample, right? Then comes the main Entamoeba histolytica and E. coli, right? In histolytica, what do we have is, see, histolytica we have 1 to 4 nuclei, coli we have 1 to 8 nuclei, right? In histolytica, what we will have? We will have erythrophagocytosis, and there it will be eccentric karyosome, right? And also in this there will be the main thing will be ribonucleoprotein, right? And also there will be chromatoid bar, which is RNP. There it will not be there, right? So all these things are differentiating features. Okay, so we can see the images also, which have how many nuclei and how many cysts. Okay, diagnosis is NCOV sauce. Okay, that is tropozoid. Okay, so they can ask the mode is feco-oral. Okay, form is mature form, and this question has come, this which is quadrinucleated, right? Infectivity dose is small. Okay, then life cycle of E. histolytica. In this we have human nose and mature. So mature is what? Quadrinucleated cyst, which I told. So question is how many of them are small infectivity dose, right? So in this we have a mnemonic chota small, CHH and SLLAM. So C means Cryptosporidium, H is histolytica, again H is EHEC, hemorrhagic E. coli. Then we have small ka S is Shigella, LLAM is Lamblia, right? So these are all the things in treatment. This question has come, which is metronidazole, right? Plus what we can give is in this also PYQ, paromomycin. So metronidazole plus paromomycin. This is two sorry are given in the lower GI bleed, right? Then we have just one thing, which is Paragonemus wastermani, right? What is this? This is crab or crayfish. This question has come, and this will be oriental lung flake or Japanese luke flake, right? Wassermani. Now there are some things. For example, we have mosquito, sandfly, sayfly. So in this, what will be the vector? Mosquito will be malaria phylaceous, sandfly will be kala azar, sayfly means sleeping sickness, redo bug means Chagas disease, and ticks means babesiosis, right? Then we have two, Naegleria fowleri and Acanthamoeba. Naegleria means in this there will be PAME, okay, primary amoebic meningoencephalitis, and then we have swimming, okay, and in this it will be like Naegleria is there, that is Nala. Nala means swimming, so that's why it will be there in the rural village, right? So there will be history of from the like of swimming, and that will be through the nose, right? So this will be Naegleria, and in Acanthamoeba it will be like corneal ulcer, that will be contact lens keratitis, which will be Pseudomonas is more than Acanthamoeba, right? Then we have granulomatous amoebic encephalitis, which will be there in eye or brain, okay. Culture will be common in both N and A, okay, and in this it will be like both of them are immunocompromised, okay, and N and AAT both are they are similar in this because it's contact lens. So Pseudomonas and Acanthamoeba, both of them will be there, right? There it will be in Naegleria it will be amphotericin B, and here it will be 4 drugs, right? So when we come to Naegleria, I told, Acanthamoeba I told, immunodeficient it will be, right? In this it will be in the Naegleria it will be only tropozoid, but in Acanthamoeba it will be cyst plus tropozoid, both will be there, right? Then in Acanthamoeba They can ask you about the spikes, which you have to see. It will be double walled, wrinkled wall. Okay, spikes. Then we have tropozoites. Okay, that will be acanthamoeba. This question has already come. Okay, then we have Balmuthia mandrialis. That will be fish shape. That's not asked. Then come Balantidium coli. Okay, in Balantidium coli, it is what? This is the one which is the only ciliated parasite of human. Okay, BB means largest protozoa invading intestine. Then again, B we have is intestinal involvement. Okay, tropozoite equal to cyst. Okay, BB is there. Big is largest human intestine, and then for the human also, for the protozoa also, the B is big ship. So that's why tropozoite cyst both will be equal to the 2 and 2. So in Histolytica, what it was, when we see the Histolytica, nuclei was 1, but nuclei in cyst was 4. Okay, in Histolytica it was 1 4, right? So yeah, it's 1 4. Then come Entamoeba E. coli. In Entamoeba it was 1 8. Okay, then comes Balantidium coli, it will be 2 2. Then Giardia it will be 2 4. Okay, because it's quadrinucleated. Then Trichomonas it's 1, right? Um, yeah, so this we know. And then come to Balantidium coli. It's what? It's bean shaped, BB big. It has cilia and treatment doxycycline. Then comes flagellate. So what's flagellate? In flagellate, it will be two things: Giardia lamblia and Trichomonas vaginalis. In Giardia means there will be angry old man, the intestine which will be there in the duodenum, right? Then comes Trichomonas vaginalis. This is the one. This is the anti-Olaf diamond and strawberries, right? Then in Giardia, it will be what? It's like diarrhea plus vomiting. Two things will be there, right? And along with this, there will be malabsorption plus flagella. All these things are of Giardia, right? In this, it will be what you will find a Dadaji, that is duodenum, right? Think of Dadaji duodenum. Then there will be falling leaves motility will be there. Okay, there will be two things will be there, so that will be two nuclei. But when they have a flagella, there will be four. So four pair of flagella, two nuclei, Dadaji duodenum, falling leaf motility. All these things are there, right? 4 into 2. And this is also pear shape or tennis racket shape. In this, there will be test which is called as string test. Okay, and in this there will be vitamin B12. So loose bulky stool will be there and abdominal pain will be there. So we can see we also it can come. Then treatment is sure. This which has also come is metronidazole, right? Then Trichomonas vaginalis. In this there will be what? In this there will be only tropozoite. First thing, in this there will be no cyst. There's anti-Olaf diamond strawberry. Okay, in this there will be strawberry cervix discharge, and in this there will be twitching motility. Okay, and 4 plus 1 5 flagella are there. Okay, so in this there will be a lace media, then diamond media, green color discharge, strawberry cervix. We have one posterior flagella, one nucleus, which will be 4 anterior flagella, right? So these are all the stuff. Then we come to hemophilia. In this there will be two things: trypanosoma and leishmania, right? Leishmanium, trypanosoma. Leishmania means promastigote, and trypanosoma means metacyclic trypomastigote, right? So in this, it's like A pet. A means A mastigote means absent flagella. Pet means promastigote, epimastigote, trypomastigote. All these three will be there, right? This the question which can come is like how how does it work? So A pet, A mastigote, promastigote, epi, and then pro is like post nuclear kinetoplast, right? So these are the things that we have a mnemonic for this, which is bat, cat, lab. Bat means Trypanoma brucei. Okay, E epimastigote, then tryptomastigote. Then comes cat. Cat is Trypanoma cruzi. First B wants brucei, C is cruzi. Then AT is the same, right? A mastigote, tryptomastigote, epimastigote. Then we have lap. Lap is what? L is leishmania. For leishmania, it is A mastigote or promastigote. Only what is seen in what, this we want to know, right? Then we have two things: Trypanoma brucei and cruzi, right? In cruzi, what is there? Cruzi means C. C means Chagas disease. Chagas disease means what? South America. East, west, north, south. Whenever you go to South America, you will see sleeping sickness, right? So in this there will be Chagas disease. In this there will be Ridovid bug, which is also called as triatomic bug. Okay, this is what you need to know. And in this there will be a sign which is called as Romanas sign. And whenever you have brucei, brucei means B. In this, what you will see is Saciflide. SS is there, so Saciflide will be there. West African and East African. And also in this there, because West is there, so winter bottom sand. Okay. Then you have leishmania. So I think this what trypanosoma was done. Now let's talk about leishmania. This is Kala Azar. Okay, in this there will be triatomic bulk stages will be there, and in this it will be like Kate in Kate no yeah, like this. Then we have leishmania we have Leishman Donovan bodies. So in Kala Azar what do we have is yes, we can see what we can see sandfly, we can see L-carnitic agent causing DNA damage, we can see massive spleen, CML, SCL, Kala Azar, this we can see. Okay, so we were talking about Kala Azar, which was leishmania. In this LD bodies are there, which I told. Okay, Amistad code, it will be there in the spleen. Okay, there is a fat person, black discoloration skin. Okay, BAL, HIV, BM is the most preferred. Okay, then we have RK39, which is rapid card test. Then we have LAMP, liposomal amphotericin B. Okay, in LAMP it will be there in two, leishmania. Okay, or it will be LAMP plus fluoxetine, that will be of cryptococcal meningitis. Then we have triple N media, it was for leishmania and T. cruzi. Okay, and NNA with E. coli will be Naegleria and Acanthamoeba. Okay, so this was all that about post Kala Azar. We can know after 1 to 2 years of treatment, it will be hypopigmented or oral mifepristone, right? So this was all about Kala Azar. Then let's talk about sleeping sickness. Okay, and there will be sachet fly, which will be BET, BET. Okay. About BET also we know that it happens on brucei. Okay. Then comes leishmania, that is Kala Azar. Okay, in which also lab, right? Then comes Treponema cruzi. Cruzi is Chagas disease. Okay, in this it will be what we can see here is we have a rich man, Mercedes Cruise Rome. Okay, so rich man American na, so that will be American essay. Then Benz means benzimidazole. Cruise means cruzi. Rome is Romana sign. Chagas disease, myocardium, megacolon, isocolon. All these things we can see. In acute, what we can see, Romana sign, periorbital edema. Okay, in chronic, what we can see, myocarditis. Okay. Then in blood sample, we can see blood sample, Buffy coat, culture, NN media. Okay. Then trypanoma brucei. So let's talk about brucei. About brucei, what do we know is BET. So sachet fly, sleeping sickness. This we also called as West African sleeping sickness. Okay, winter bottom sign. I think these two are enough. Okay. Rest, if you want to know TB, road Nissen, that will be East African. That's not much asked. Then let's come to what you can come. You can come to coccidian parasites, right? In coccidian, what you have is Toxoplasma gondii. Okay, Cryptosporidium, Cyclospora, Isospora, all these three. Then Sarcocystis at the end. So gondii means HIV positive patient plus CD4 less than 100. Okay, HIV plus diarrhea, that will be coccidian, right? This also you can remember. You have cat, you have uncooked meat, Toxoplasma gondii you can see. Then you have in this mode of transmission, when you see sporulated oocyst, badizoids, BT. Okay, or you can here also BT, it will be a blood transfusion, tracheozoids, or here brachiozoids and tissue, right? All these things can lead to Toxoplasma gondii. And if you have congenital adult or HIV, if it's congenital, it will be severe in trimester 1, then 3. Okay, C3M2, chorioretinitis, calcification, convulsions. Okay, torch infection, microcephaly, mental retardation, like this. If you have adult means lymph node enlarged, asymptomatic. Or HIV plus toxoplasma means then it will be encephalitis or brainstem affected, right? Toxoplasma is what? It is the one which show intracerebral calcification. CMV means periventricular calcification. Cerebral toxoplasmosis, the drug of choice will be spiramycin, right? Then we have Sabin-Feldman test, gold standard of toxoplasmosis. Okay. Then we have what? Diarrhea. If you have diarrhea plus HIV, then it can lead to more problems. Let's see three things. This is important. Cryptosporidium, Cyclospora, Isospora. Crypto means cryptocurrency, that means it will be Nita's oxide, that will be Nita, right? And it will be 4 to 6. 4 to 6, 8 to 12, just double, and then also double. No, then don't double, then triple it. 8 3 ja, 8 1 ja 8, 8 was 16, 8 3 ja 24, 12 3 ja 36, like this, right? So cryptosporidium, then cyclospora and isospora. Cycle means raspberry consumption. Okay, so that's why this is the one which will be variable. Then you have isospora. Iso means 4. So that means in this there will be uh, this will also will be same. In this the main thing, it will be cotrimoxazole, right? So we have the C, we can see the variable one, which we will find different among all. Okay, so first a round, and the third isospora will be oval, right? HIV, whenever you have meningitis, that means it will be cryptococcus. Whenever it's diarrhea, that means cryptosporium. In coccus, it will be lamb plus fluorocysteine. In sporium, it will be nita oxide. In sporium, it's what? Auto infection. Okay, brush border like this. Then parasite. In parasite, we have what? Vivax, falciparum, malaria, and oval, right? So Vivax and oval, it will be like when it's inactive in liver, okay, which is relapse. Then what is inadequate treatment and recrudescence? That will be 2 PM, like falciparum and malaria, right? What it will be infectiform, okay, sporozoites, trapezoids, okay. Then it will go gametocytes, and no relapse in malaria with blood transfusion. So let's come to the main thing. First, what they will ask is light microscopy. Thin or thick? Thick means species identification. Thick means for quantification of malaria. Thick quantification malaria, all emergent and more sensitive. Then we have just one classification here, all emergent. Then we have Vivax, ovale, and PM, right? So usually it's like PM is Mauritius cleft, and here it will be Xi malaria. There's some main cleft, Xi man, right? It will Mauritius all age group, normal, multiple ring, renal failure, banana shape. Moria will be banana shape. In this, it will be GST, G6PD deficiency, sickle cell, thalassemia, GST, right? And malaria will be band formation. Okay. So we can see falciparum, it will be banana shape, and it will be for macro females. In malaria, it will be band shape. Okay. In Vivax, it's what? Just one dot like this. So this is how we can see and classify them. Okay. All emergent, thick for thick skin, all emergent, more sensitive, all these things can be there. Just now, let's just identify it. Okay. So in Vivax, what do we have? Is we have tropozoites. Okay. One ring, one dot early. Okay. Trapezoid, we can see amoeboid form, that will be the late. We can see the macrocyte, okay, which is peripheral, and spherical also. We can see gamocyte, schizoned. Then in falciform, what do we have? Is we have multiple rings, okay, multiple rings we can see, and equol we can see. VQ also comes about it. It is banana shape, chromatin, and about malaria, okay. PM, that is band form, malavent, right? So for this, what we can do is acridine orange. Okay, it uses fluorescent dye. Also, we can do rapid diagnostic test, card test. Okay, whenever it comes to banana, it will be what? It can be hypertrophic cardiomyopathy. Okay, falciparum, and if it is in grape appearance, then spaghetti and Malaysia fervor, right? All this. Then we can see whenever it will be invalid. Usually, it's whenever you see A means PF is HRP2, right? So you can see when it will be invalid. If it is mixed also, anything is positive, negative also, then it's okay. But if it is not, then it's invalid. By BCS also, this question is come Maltese cross appearance, tetrad of ring. Okay, this is the VQ which we can see, right? Malaria, in this is be heart, tick, rodent, all these things will be there. So we have done parasitology part 1. Okay, now let's talk about part 2. In part 2, it will be what? We will have cystodes. So we have 5 out of them. Okay, Nana diminuta, latum, solium, nata, and then we have echinococcus, that will be haired cyst, right? In Nana, it will be what? See, all of them are men except last one, that will be dog. Okay, then comes the first one, H Nana. Nana is the one which is the smallest. Okay, so this question has come, and also in this, most common this is the most common Nana, and also this is the one which is the single host, right? In this there is no immediate. Then comes diminuta. Minuta means minute. So what will be minute? It will be red, right? Okay, this is the extra one. Okay, then comes latum. Latum means three hosts will be there. Die fish ho. Okay, die fish means first chota fish, then bada fish. Okay, die means two fish. So bada fish is there, and water fish, and first will be cyclops, chota fish, right? And in this it will be what? This is the one which is the largest one. In this there will be vitamin B12 deficiency, megaloblastic anemia. Then comes solium. Solium is what? This pork typhon. Pork is what? Pork is pig. Intermediate host will be pig. Solium is. Then it will be what? Pig is there, so it will do starry sky appearance, and also in this there will be neurocystic circus, intestinal involvement. Then comes saginata. Nata means two T is there, that's why it will be intermediate host will be cattle. It will be intestinal involvement. Then comes echinococcus, that will be dog tapeworm, that will be hydatid cyst. In hydatid cyst, it is dog and sheep. This is the one, and in this the human is the accidental host. Imaging will be what? Water lily sign, ARC5 immunoelectrophoresis. Okay, these are very important. All water lily sign, ARC5 immunoelectrophoresis. Okay, Cassoni test we have, type 1 hypersensitivity. Okay, then we have FNAC, which is contraindicated. Okay, so this we have done. Whenever come sky appears, it will be Burkitt, PSGN, and radio neurosurgery, right? Then we have treatment. In all cystoid, it will be praziquantel, but whenever it's hydatid cyst, it will be albendazole or surgery. In NCC, it will be steroids, right? So we can say cystodes. So what are the cystodes? Usually it's we can see here 6 are there, right? We have diminuta, smallest one. Okay, sorry, diminuta is not the smallest. Smallest is the Nana. Okay, then what we can see in this, there in diminuta there is no yolk, no pore. But whenever cystode egg, in this there will be polar knobs. Okay, hexacanth embryo, and there will be 6 hoculate eggs. All these things are there, right? Then we have diminuta, I told, and operculated also. In this there will be protector egg is seen, and its mnemonic is STD, Spirometra, trematode, and latum, right? These three are there in the operculated egg. Now, what do we need to know? Latum, right? First we are talking about latum, which I told about. This is largest, longest. Okay, megaloblastic anemia, this I told, and also in this all cystoid praziquantel, this question has come. Megaloblastic question has also come. Okay, so in this what you will find a fish. Okay, fish I can see, and I can also see the cyclops. Okay, this will be Nata, and if the question about complaint of seizures, MRI in brain, then it will be what? Certisclerosis, right? Then comes solium and saginata. Okay, in solium and saginata, what do we have is, it was pig and cattle, right? If you see pig and cattle, which I can also see, pig and cattle, that will be solium and saginata, right? In this it will be 6 hoculates. Okay, and in saginata it will be more, solium it will be less. Okay, so nata means two together, that means cattle. So it's the one which presented cattle, beef, and cows, but not at all in human. You won't find this in human, but whenever you see it's in solium. In solium it will be what I told in solium. In solium I told that this is the pork. Okay, pig. So usually it will find in pig and male. So I don't say you to compare with it, but still, with pig it is solium, right? And also that will be cysticercosis and neurocysticercosis, right? Egg not float in saturated salt solution. So this was the thing. Saginata and solium also you can see. Okay. Yeah. Now let's move forward. In this there will be starry sky appearance, cysticercosis, seizures. Okay. In CT you can see multiple cyst. Treatment will be steroids. Okay. Praziquantel will be there. Then comes HS, Nana, and diminuta. About Nana, what I told. Nana told nothing. Diminuta means what? It will be beetles, right? Whenever you see beetles, okay, then it will be in Nana it was human, in diminuta it was rat, right? Whenever you see rat, you can understand it. Okay, then comes echinococcus. Echinococcus is the one. In this it was dog and sheep. So wherever you see dog and sheep, that will be echinococcus. Water lily sign, main accidental host, and hydatid cyst. This is there, right? In human I told, hydatid cyst also I told, right? Then we have pearly white, 3 layers, pericyst, ectocyst, endocyst. Okay. Yeah, this I have told. Then we have what? Ectocyst, paintbrush appearance, and all these things we can see later on. Just 3 things common: peri, ecto, and endo. Peri means what? Peri. Only host derived cysts are there. Whenever you have only host derived, that will be peri, right? Ecto means what? Ecto is the one which is paint, which has paint. So paint brush borders will be ecto. Okay. So peri means what? Only host. Ecto is paint brush. And what is endo? Endo is the one which is germinal layer, new organisms. Okay. All these things will be there in it. Then come multiloculars. So in periecto, in this question has come. Now comes multilocularis. This is what? Alveolar hiatus cyst. In this, what you have is liver, lung. Treatment is there. Granulosis will be pair. This mnemonic is there in the granulosis one. That will be pair. Pair is puncture of cyst. A is aspirate. I is injection. R is re-aspiration. So these were all the things. Now let's talk about trematodes. In trematodes, what do we have is, first just remember the names, then we go to host and all. In trematode we have Schistosoma, Paragonium, Wassermanni, Chlorhyssus sinensis, Opisthochus. Then we have Facula hepatica, Facula busci, right? In Schistosoma, what do we have is, see, definitive host is same, man. First is also same, snail. Only the main thing is, this is also called as what, and what the secondary intermediate, right? Schistosoma, blood fluke, man, snail, right? Wassermanni. Wassermanni means what? In Wassermanni means it is lung or fluke. This is what do we call as, right? And its second intermediate will be crab or crayfish. Wassermanni. The question has come. Lung fluke also and crab crayfish. Okay, it has come. Then kiss. Chlorhyssus sinensis. Chlorhyssus means fish. Fish is what? Liver fluke, right? And also in this, the second intermediate host will also be fish, right? If you have Opisthochus, whenever you have that, means that's also fish. And snail is already there, right? Then you have Fasciola hepatica and Fasciopus busci. Whenever you have sheep, Fasciola, right? That means sheep liver fluke, right? Hepatica means liver, Fasciola means liver fluke, right? So sheep liver fluke, and in this, two of them will be the same. Both Fasciola, it will be fresh aquatic vegetation. Okay, and both fish will be, fish were the fish, and Fasciola means fresh aquatic. FAF is there, right? Fresh aquatic. So in busci also it will be intestinal fluke. So question has come about Fasciola hepatica also, right? Okay, done. So now let's talk about infective form, transmission, and eggs. So in infective form, all of them have metacercaceal larva. Then ingestion is there in transmission. Hermaphrodites are there in adult form. Okay, spinous eggs are there. Treatment also, praziquantel is there. Only one thing, schistosoma. She says that something else should be there. Then infective form is Cercasia, or S or C will be there. Cercasia larva, skin penetration. This question has come. Sex separate. This question has come. Spinous eggs and praziquantel. Only Fasciola hepatica. Okay, fluke liver, that will be triclabendazole. This question has also come, right? Operculatory add with lids. If they ask you about lids, then all trematodes STD. Okay, Spirometra trematodes all except schistosoma because it's spinous eggs. Okay, and D is latum. Then you can see what are operculatory eggs and what is later one. Later one is S. mansoni. Okay, and spinous means spinous, obviously. Terminal is won't. S. hematobium because it's terminal to tobium. Lateral means mansoni. Okay, then it's japonicum because it's rudimentary. All trematodes, praziquantel, Fasciola means terminal. This I know. Okay, now schistosoma. In this, what do we need to know? The main thing is hematobium, mansoni, and japonicum. Hematobium was what? Mansoni was what? And japonicum, right? So let's talk about hematobium, right? In hematobium, it was what? We can understand it was terminal spine, right? In terminal spine, it will be what? Squamous cell. This is very important. This question has come. This is a squamous cell. Okay, and whenever your main soni is what? Lateral one. Okay, and lateral, that's why it will be inferior mesenteric plexus. This question has also come. Okay, so in Manzoni it was the lateral, and inferior mesenteric plexus they involved sigmoid and the hematobium was squamous cell. Okay, so now let's talk about more. Wassermanni, it was pulmonary involvement of GI tract. You have clonus means Chinese or Oriental liver fluke, clonius ophthalmos. Okay, in this there will be CCV cholangitis and cholangiocarcinoma ophthalmos, right? Then you have fasciola hepatica, sheep liver. Okay, in this there will be what? Jaundice, right side abdominal pain, all these things. Then there's a PYQ of cystosomania, in which there will be pipe stem fibrosis or liver, right? Then you have acute and chronic. In chronic, what you have is pipe stem fibrosis. Okay. Then cystosoma, you can see the snail. Whenever we find sac separate spinal sac, you can see. So one thing is a question which has already come, that but in cystosoma there is only MCC. Okay, so means the main thing is radia is not seen in which of the trematode cycle. Radia. Answer is cystosoma. In cystosoma, radia is not seen. Just remember, right? So in Wassermanni, what we told about, it was crayfish. Okay, crayfish and ingestion of the snails. Okay, this you can remember. Then clonal means Chinese liver fluke. Okay, whenever you find CC means cholangitis, cholangiocarcinoma. Okay, Chinese liver fluke and Oriental. Okay, so this all we have done. Then comes to nematode. In nematode, what do we have is we have some stuffs. For example, we have intestinal somatic. Okay, in intestinal, what do we have is we have small intestine, large intestine. Small we have round worm, hookworm, strongylides, also called as lung stage. In large intestine, we have tricharias, enter BS, right? In somatic, we have all LL, Filaria, Trichinella, Drunculus, L, right? And roundworm, what we call as Ascaris lumbricoides, hookworm we call as Encyclostoma, right? Now are the birds. Okay, you can just remember just one thing. In oviparous means eggs are there, then later it will be larva, right? So letter TER, T is trichurus, E is entobius, R is roundworm, right? If only viviparous is there, then it means larva. All L were there, right? But if they ovo viviparous, ovo means up to immediately, then it means be strong. It will be strongolites. Okay. So these three things we have done. Now let's see Ascaris lumbricoides. We can see the eggs. Then we can see the trichurus. Okay, in this it will be what? This will be barrel shaped. Then we have encocyclostoma. This also, all these questions have come. Okay, that it will be O will be there. So ankylostoma, that means hookworm. And when you see D, then it means enterovermicularis. That will be plano convex. Okay. Now what we can see is Ascaris. In Ascaris, that means what? It's roundworm. Okay. So you can see low flower alpendazoles. Okay, you can see female and male, larger and posterior coil, that will be Ascaris. Okay, and then comes what? Trichura. In Trichura, which is this is also called as whipworm. Okay, in Trichura, you can see is barrel shaped mucus. Okay, and yeah, in Trichura it will be dysentery, rectopurus, coconut cake rectum, blood in stool, coconut cake rectum. This you can see. Then it's enterobius vermicularis, which is pinworm. Okay, so in pinworm, what we can see is threadworm, enterobius vermicularis. In this, there will be what? This question is come perianal pleuritis, perianal swab, scotch tape. This will be vermicularis, enterobius vermicularis, or pinworm. Okay, in this, there will be posterior and coiled. There will be 3 cervical LA, plano convex X. This will be there, right? This question come now. Next, it can be encyclo. Yeah, and also in this there will be scotch tape, which I forgot. There will be scotch tape. Okay. Then encyclostomata and hookworm. In hookworm, what we can see is hook. So X will be there with blastomeres. Okay. Ground itching will be there. Creeping eruption IDA. IDA with hookworm or beta 12 minus. That will be dilatum, right? So this we can see in cyclostomata or hookworm. Okay. In skin we can see schizostoma, strongyloids, and cryostomata, all these things, right? Then what do we have here is in cyclostomata duodenal eggs we can see same. Okay. Egg rhabditiform larva, this will be same. Okay. So what will be different? Different will be only adult worm, philophilum. Main thing will be pathogenesis. In encyclostomata, it will be more pathogenic. In nectar, it will be less pathogenic, and ground itching will be more severe, right? This differences we can see. Same will be egg and larva will be same. Okay. And adult worm and filiform larva will be different. Only two things. Strongos means strong. This is the one which has a different treatment, which is ivermectin. Okay. In this there will be what? Mode of transmission is skin. Okay. Rhabdiform larva is their diagnostic. Okay. So we can see what? HIV positive female egg died to hyperinfection. Ovoviviparous means what? Strongyloids. Okay. So this we have seen. Okay. We have also we have seen what rhabdiform larva. We have double bubble bulb esophagus. These things we have. Filiform larva enter the body. Rhabdiform larva comes. These things are there. Then comes Trichinella spiralis. Clasper in male, hold female during mating. This is very important. In spiralis. Okay. Host will be pig. And treatment is albendazole, which is the same. Okay. I think Daculus medinensis. This is guinea worm. Only this much we can see. Like drinking water, it is used. Then comes filaria. In this question has come on Wucheria bancrofti. Okay. This question has come many times about bancrofti. So it is the one in which there will be no nuclei at tip, and in filariaceae, right? Bancrofti 50. That is filariaceae, which is Phantiasis, which will be Culex, Aedes, and Anopheles. Then if it is Brugge Malay, then it will be two nuclei will be there. So whenever your Malay means two nuclei, whenever your Bancrofti means no nuclei at the tip, right? Then you have Loa. Okay, so all these three are sheathed, rest three are non-sheathed, right? So yeah, this you can remember. Then the main thing is the images. Elephantiasis. Okay, milky fluid urine. Okay, lab diagnosis will be the blood. Okay, and what we can know here, ultrasound will be filariaceae dance sign. Antibody non-specific, antigen is specific. So which antigen is specific? This one is specific. Questions come. ELISA, which is OG4C3AG. Drug of choice DEC. Okay. Then comes Malay. Malay means what? We need to do a difference between both Bancrofti and Malay. So Bancrofti is the one which is monkey, from monkey, and in this there will be two nuclei. Okay. So what will be involved? So difference from WB, Bancrofti will be leg below the knee will be involved. No genital involvement, no hydrocele, right? So all these things will not be there, which because this is a difference from WB. This has come from monkey, right? Otherwise, in that everything is involved. Now third, what we have is volvulus. In volvulus, what we have seen is, yeah, this is important. In Oncaria, volvulus or convoluted worms. This will be in eye. It will be river brandness, and drug of choice is ivermectin. Then we have Loa. That is what in this it will be Calabar or fugitive smelling in Loa. Okay, fugitive smelling, and and this can be pruritus fever. All these things will be there. Then we have egg auto-infection, which do not float, right? This we can see. So the whole chapter of parasitology is done. Thank you.